Hello everyone, and welcome again to another episode of the Midwest Concussion Clinic Lunch and Learn. Today, I'm going to talk to you about the ideas behind concussions and mental health, the silent struggle that all of our patients will deal with throughout their concussion recovery. Again, for those of you that don't know who I am, my name is Matt Campbell. I'm the owner of the Midwest Concussion Clinic. We specialize in bringing 100% virtual concussion rehab, education, awareness, and diagnosis to you in the comfort of your own home. Every third Wednesday of the month at 12 p.m. Eastern Time, I host a free webinar that I call the Monthly Lunch and Learn. Grab your lunch, sit down, let's chat. And as always, follow along. Thanks for being here. So the goal behind today's presentation is to talk about what happens with the relationship between mental health and concussions. This is where my soapbox comes into play. I am a major advocate for the mental health world. I think it's very important that no matter where you're at in life, that everybody should talk to somebody at least once a year, even if things are going great, because it's always nice to have an unbiased third party. When we go through this lecture, I'm always available to answer questions via my email at matt@mwconcussion. Here on our TikTok at MW Concussion. Over on YouTube, we've got our YouTube channel, the Midwest Concussion Clinic. Facebook's got the Midwest Concussion Clinic. Instagram and X are both at MW Concussion. I'm very approachable. My goal in life is to help people. So if you have questions about anything that I'm about to talk about, I'd love for you to reach out, DM me, shoot me an email, say hi. And just know that when it comes to concussions and mental health, you don't have to go through it alone. And when it comes to mental health in general, you're not by yourself. Okay. So the goal of the webinar today for the next hour, I'm going to talk to you about concussion information and statistics. We're going to talk about the prevalence of concussions, how common concussions really are. Again, I run a concussion clinic, so we're going to go over the basics on what concussions are, how we treat them, and how we manage them. Then we're going to talk about the idea behind concussions and mental health statistics. I'm going to talk to you about, the idea or the prevalence of depression, anxiety, any, suicidal ideation, self-harm. So if you do have any kind of trigger warnings, we are going to talk about that kind of stuff in the middle part of our lecture here. It's a major component of concussion recovery that often goes unaddressed in the medical world. So it's something that I want to help bring awareness to make sure that not only do my patients understand that I get what's going on, those of you that are out there navigating your concussion recovery by yourself, you have an understanding of what we experience, and to know that you're not alone during the process either. And then the last thing we're going to talk about is some treatment options for post-concussion mental health disorders, some things that I recommend, some things that I've picked up and tips and tricks along the way. And this is where, if you're over on our TikTok live and you've got some ideas, I'd love to see the ideas on what you like to do for your own mental health, whether you've got a concussion or not. And we'll add this into kind of the daily routine. My goal is to take what we talk about and continually push it out on social medias to help even those that don't have concussions navigate through some mental health concerns. So as we get into this, we have to go over the basics. What is a concussion? For a long time, we used to tell everybody that concussions were a bruise, that when you hurt your brain, that your brain would smack would smack different ridges inside the skull. You would get some bruising that develops. We would CT scan, X-ray, MRI. We would do some advanced imaging right away. Majority of the time, those advanced images will come back negative because there is no structural damage that occurs. So the basic definition of a concussion is a traumatic brain injury caused by a direct blow to the hit, or a direct blow or hit to the head, or a hit to the head, neck, or body that causes a rapid jolting motion and disrupts the electrical signal inside the brain. So again, there's no structural damage that occurs. I can argue on a microscopic level, there's structural change that occurs, but from the big picture, a phrase I use with my patients, if I were to cut your head open and take your brain out and look at it, it would look the exact same as it did before you got hurt in most cases. It's because there's no real structural damage. It's an electrical signal disruption. That electrical signal disruption, though, will cause a neurometabolic cascade that happens, and it disrupts energy production and hormone production and regulation inside the brain. Again, when we start talking about concussions in general, structurally the brain looks okay, but electrically it causes some issues. That energy disruption causes the mental fogginess, the neurofatigue, and then the disruption of hormone production and regulation of the hormones inside the brain is what can lead to some mental health struggles during concussion recovery. The challenge with the hormone regulation is, for all God's infinite ability and wisdom when He created us, we do not slowly regulate our hormones. It is something that is done rapidly and then we adjust. So when we look at hormone fluctuation, there's a major hormone fluctuation that occurs immediately after the injury, and then throughout injury recovery, there's some play that goes up and down with hormone levels. On a very basic sense, this is why a lot of female concussion recovery takes longer than male concussion recovery. It has to do with regulation of hormones based on puberty, pregnancy, pre-pregnancy, post-pregnancy, menopause. There's a lot of factors that go into concussion, hormone regulation post-concussion, and leads to longer recoveries in our female patients. So how prevalent are concussions? How often do concussions happen? The big one is, in the United States, every year, there are up to 3 million concussions that are diagnosed in the emergency department or by primary care physicians in just the United States. The problem with that number, though, is not everybody goes to the emergency room, or not everybody goes to their primary care physician. So the fact that we have 3 million diagnosed concussions in the United States alone per year looks at the fact that those are the ones that are bad enough that people will rush to the emergency room. They're transported by EMS. They haven't been evaluated by somebody outside of the emergency room, whether it's an athletic trainer, whether it's, a friend, or, a nurse that your neighbor happens to be a nurse, or somebody that you know. These are the ones that are just doing formal diagnosis and are opting into that research study. So that number, 3 million, sounds like a lot. It could be a lot more than what we know based on the data that's coming in. The other thing that we know is there's an estimated 51% of concussions go unreported every year. That's those people that either, one, don't know an injury has occurred, two, were diagnosed with something other than a concussion in the emergency department. We see that a lot with car accidents. You're diagnosed with, closed head injuries, whiplash. They don't address the brain injury aspect of things, especially if there's more physical injury going on. People, patients can get discharged all the time without knowing that they've been diagnosed with a concussion. So it can be a challenge there. And then you have the flip side of that. The athlete nature is, I want to continue to play. I don't want to sit out. I don't want to be out. So we have, that number kind of roped into it as well, as not everybody that's diagnosed with a concussion, or everybody that gets a concussion, reports that they've had a concussion. I am one of those people that I work in the medical world, right? I live in the real world. Not everybody is trying to hide their concussion from somebody else, right? Not every athlete is trying to hide the concussion to get back on the field, but there is a culture around concussions in sports that is really, really frustrating for me in particular, but frustrating in general, because there's a major push in athletics to continue to play. Whether it's ingrained in the athletic personality, I am one of those that athletes that are built to continue to push through, to continue to play. TJ McConnell of the Indiana Pacers made a comment this NBA Finals that playing hard is a skill, and I agree 100% when it comes to continuing to play. There are people that develop the ability to continue to play sports no matter how they're feeling, whether it's they were born with it and it's something they've molded over the years, or they've been taught it through upbringing, through coaching. That ability to continue to play is a skill. The challenge when it comes to concussions is they're taught that you can play through anything. And I can continue to go, I can continue to play. But when we look at brain injuries, continuing to play through a concussion is a life-threatening decision that you're making. Okay, so that 51% of concussions that go unreported, it's not just because athletes are hiding their symptoms. They may not know. A lot of times it's hard to express how you feel. I don't know why, but why I feel off, or I don't know what's wrong. I just don't feel right. I don't feel normal. And if they've been given no concussion education prior to the injury, they may never know. There are a lot of kids that fall on the playground that, never, the mom or dad are never taken the kid in to get diagnosed. And, the likelihood that they got a concussion is relatively high when you have somebody who falls off monkey bars or flips off a swing. Car accidents, a lot of times concussions go unreported. And then there's the prevalence for domestic violence, especially here in the United States, that if we truly knew how many people were victims of domestic violence or intimate partner violence, that concussion number goes up significantly. So the fact that we've estimated 51% of concussions go unreported is challenge enough or scary enough. But then we look at the fact that that number is probably a low estimate in the big picture. And then the last statistic that I want to share with you on the prevalence of concussions is that 1 in 5 athletes will get diagnosed with a concussion every sports season. That's not every year. That's every individual season, right? So if you're looking at a team of 15 people, you've got 3 people on the team that 3 people on that team will get a concussion at some point during that season. If you're looking at a big school, that number goes up significantly just based on the number of athletes, 1 in 5, right? So it's a high number of athletes that get diagnosed with concussions, but concussions are not only an athletic injury. There's a significant risk for concussions with falls, with car accidents, with being struck by something or acts of violence. And sports that, we look at those are the top 4 causes of concussions. Sports gets a lot of media attention. It gets a lot of the attention in the big picture, but it's not the only cause of concussions that we know. And it's the 3rd leading cause overall. And I would say it's lower than that if we truly knew the scope of intimate partner violence or domestic violence prevalence with concussion. So concussions are not something that just randomly happen. It's not something it's a one-off or, it happens every now and again. Concussions are a big part of not only the athletic landscape, but the day-to-day lives of adults as we move forward. So now let's tie it back into mental health. Okay, what does mental health mean? Mental health is not just, what's going on between our ears. Mental health, yes, it has a lot to do with the brain, the mind, and how the mind works, depression, anxiety, PTSD, suicidal thoughts, self-harm. But when the mental health is disrupted, when there's something that's been diagnosed or when there's a mental health challenge that's occurring, it can also address our physical health. There's been a lot of research that looks at what happens when mental health struggles occur to big picture overall concussion recovery or overall person health. So when we look at mental health and concussions, it's a complex relationship, but at the same time, it is a very, very common thing for people dealing with concussions to also deal with mental health struggles. You're going to learn here in a minute, it's not only if you've had mental health issues prior to getting diagnosed with a concussion, we can develop new mental health challenges after a concussion and even up to, a year, 2 years, 3 years, a lifetime after you've completed your concussion recovery. So that relationship between concussions and mental health is one that is very, very prevalent in the big picture. So when we talk about mental health and concussions, I'm going to break it down into 2 groups. The first one that we're going to talk about is youth athletes, adolescents, ages 19 and under. Okay, so if you're reading through and you're looking at the slide, you're like, man, I'm not a youth. I'm an adult. I'm a freshman in college. I'm a senior in high school. I'm not a kid. Well, in the big picture, in adolescence is 19 and under. So this is what we're going to talk about in this group. And then the second group that we're gonna look at is the adult population, 19 and over. So some statistics that I like to cover. When we talk about mental health and concussions, mental health is a bad word at times. We're getting better at talking about mental health. We really are. There's a lot of push in the media. There's a lot of spokespeople, a lot of not-for-profit organizations that are doing fantastic jobs to not only bring awareness to concussions and awareness to mental health, but also offering avenues that are affordable for people to navigate through their own mental health challenge under the direction of somebody who's trained to help. And so when we look at it, this is my personal soapbox. It's okay to not be okay. It's okay to need to talk to somebody. It's okay to not have to navigate through your mental health challenges alone, especially if you have a concussion that's disrupting the electrical signals inside the brain, the chemical production, the hormone regulation. It's okay to need help navigating through those mental health and concussion challenges. In the big picture, when we look at mental health, it is not just a concussion problem or an athletic problem. It's not just something that we deal with, right? It can be caused from a lot of different things, from injuries to the pressure to succeed, the isolation from not succeeding, being kicked off a team, getting cut from a team. These are challenges that are prevalent in the athletic world and the youth population, not just the adult world or the professional sports world. You think about, you have a 13-year-old that's trained for their entire life to make the freshman team in high school, and they're cut because they weren't quite good enough to make it. This person has put in blood, sweat, and tears, and now all of a sudden they're told that they're not good enough. And we expect the mental health to be okay afterwards without really having to do anything. No injuries occurred there, right? There's been no diagnosed concussion. There's been no issue with it. But now all of a sudden, we have somebody who's identified as a basketball player or a football player or a soccer player for the last couple years of their whole life, now told that they're not good enough to be a part of a team. It can be a real challenge when it comes to the mental health. Now you add in the entirety of being a kid in the United States and Canada. Being a kid in general in today's society is very tough. When I was raised, we didn't have the same access to social media. It wasn't an immediacy to do anything. You could get away with a whole lot more than you can in today's society based on the prevalence of social media, the immediacy of everything's being recorded, everything's being written down, everything's got pictures or videos or being talked about in an immediate way that I can touch people with my content on other sides of the world by just hitting send on Instagram or on TikTok. It's an incredible world that we have, but it's got its own challenges that come with that. So when we talk about the mental health challenges post-concussion, it's not just a sports injury. It's not just an injury that occurs that causes problems with mental health in youth and adolescents under the age of 19. Being a kid alone is hard. Navigating through school, friendships, relationships, puberty, everything that comes along with changes and fluctuations in hormones. Now we add the unpredictability of a brain injury on top of it. It can cause some significant issues. So looking at the numbers, 40%, there's a 40% increased risk in developing a mental health disability following each concussion. That's not just if I've had a concussion, it's 40% higher. Each concussion that you sustain, that risk goes up by 40%. That's an astounding number. That's a high number. And that's not looking at just mood disorders like depression and anxiety. That's looking at everything from developing suicidal harm and ideation, homicidal harm or homicidal ideations, looking at PTSD, isolation, separation, anxiety, depression. It's a 40% chance to develop any mental health challenge after a concussion. The second kind of statistic that I want to go over is up to 30% of our concussion patients under the age of 19 are symptomatic after a month. Think about it. If you're an athlete, right? We'll look at athletes first because that's where a lot of my knowledge comes into play. But then we're going to look at the general population for our younger kids. You're an athlete. You're symptomatic at 30 days. That's 4 weeks. If you're a wrestler, 4 weeks of your wrestling season is a majority of the season, right? 4 weeks of a football season doesn't seem like a lot, but when you have a kid that only identifies as a football player, they're missing practices, they're missing games, they're missing lifts, they're missing film study. Hopefully we can keep them at the football practice, and that's going to go into how we kind of navigate through the mental health challenges in a little bit. But hopefully we can keep them into those routines and keep them at those practices. But if not, they can lose friendships, they can lose relationships, they can, they have issues with regulating hormones and emotions. Now all of a sudden we're dealing with complete changes in personality, complete changes in identity, and hoping that, hey, we're not going to develop any kind of mental health challenge or, not going to struggle mentally after your concussion. It's just not realistic. So the fact that up to 30% of our concussion patients under the age of 19 are still symptomatic after a month, think about what that's going to do to mental health when we're taking things away from them, making them isolate. Where a lot of the world is still recommending no screens, sit in a dark room in recovery, which is not correct either. But when we tell somebody that, you tell an athlete that, hey, you're going to be out for a month, no friends, no phones, no video games, no TVs, no practices. Maybe you can go to school, maybe you can't. Your job, you're not going to work. Think about what that's going to do isolation-wise to the mental health of an individual, right? Not even just thinking about your own shoes. If you've got if you're a parent, if you've got kids or you've got friends, think about not being able to see them or seeing them down and depressed for a month because they've been dealing with a sports injury. Now we add to that kind of scenario, what happens if it's the big game, the rivalry game, the conference championship, the state finals? Those are things that we take into consideration when we're working with mental health challenges after a concussion. Because if I'm missing the big game because I've got a concussion, it's very different than missing the first 2 weeks of fall camp. From a coaching standpoint, it's not supposed to be different, but realistically, it is very different missing time in preseason versus missing time during during that postseason play or that postseason run. Again, we talked about a little bit earlier some of the trigger warnings that are going to come in. We are going to talk about self-harm and suicidal ideation. So when we look at for our youth patients, you got a 1.5 times increased risk of self-harm and suicidal ideation following a concussion. That is a staggering number. That you are 1.5 times more likely to suffer from self-harm or suicidal ideation and attempts. That is, as a parent, that's terrifying. Knowing that if my son or my daughter gets hurt, that we have to not only worry about how they're doing physically, but the fact that there's an increased suicidal risk, there's an increased self-harm risk because of the changes to inhibition and the changes to the brain chemistry makeup is very alarming in the big picture. Now you ought to add on the fact that if you've had 2 or more concussions in a 12-month span, that doubles your risk of suicide attempts compared to only having 1 or fewer concussions for patients under the age of 19. So if you've had 2 or more concussions in a year, that's not great in terms of brain health and brain chemistry. Now we add on the fact that if you've had 2 concussions in under 12 months, you're doubling the risk for suicide attempts. That is scary, especially when we look at the big picture of the mental health services, of the mental health support in the healthcare system. Since 2020, the mental health services are being overrun, being overwhelmed with people, with patients, with new challenges, funding, budget cuts, bringing in new providers, just the sheer number of patients. Now, if we're looking at football, basketball, baseball, rugby, lacrosse is adding to that injury or that concussion risk, then we get 2 or more concussions in a year and we're doubling the chance that you will attempt suicide, is an alarming pandemic that needs to be addressed. So when we look at, just the basics with concussions in youths, it's a significant increase in developing mental health challenges, and it's a significant risk in self-harm and suicidal attempts and ideation. So let's look more at some of the common mental health challenges that we'll see post-concussion. So the first one here is anybody who's been diagnosed with a concussion under the age of 19 has a 37% higher risk of internalizing mental health problems. The study that was done on that looked at not necessarily that they develop them, but the idea that they're not going to tell anybody about it. That they either don't know how to express how they're feeling, they are ashamed because they don't want other people to know that they're struggling, or that they're fighting to keep things inside, not to worry those around them. A 37% chance higher risk of internalizing mental health struggles has to be addressed long before the injury occurs. One of the challenges we run into, especially in the concussion world, is the education on concussions and the total scope of them before the injury ever happens. Think about the first time you heard about concussions, or the knowledge of concussions that you have generally comes from the media. From TV shows like ER, Grey's Anatomy, Scrubs, and New Amsterdam, to the TV shows or to the movies like Varsity Blues, Blue Mountain State, where concussions are a bad word, to every football documentary that you can watch on Netflix. They're a passion of mine. I really enjoy watching the Titletown and the Last Chance U and things along those lines, where you've got athletes that are really trying to make it out and into the world, and every single one of them will address concussions. And for the most part, they glance right over them. They talk about, oh, he's got a concussion, he's out this week. And then a coach will make a comment that, well, he doesn't matter because he's out, or he's soft. Like, does he really need to go to the doctor for that? Did that actually happen? So the general population's understanding of concussions is so skewed or misguided because of how they're portrayed in the media, how they're portrayed in our movies. So if we don't educate people on the prevalence of concussions, what actually happens big picture, the brain chemistry, chemical makeup, it leads to a lot of internalizing concussion symptoms, because they either, 1, don't want to tell anybody because I don't want to be out, or 2, don't know how to express how they're feeling. The next number here, 29% of patients with a past mental health diagnosis will develop a new problem. Okay, what that means is if I go into the injury, I've got clinical depression prior to getting my concussion, I'm at a 29% higher chance of developing a new mental health diagnosis after my concussion. That's not just while recovering from our concussion either. That's after I've completely recovered. I've got a 29% chance increased risk of developing a new mental health challenge or mental health diagnosis after a concussion. The third one here is 40% of our children diagnosed with a concussion will indicate some form of subclinical anxiety. Subclinical anxiety just means it doesn't hit the threshold for formal diagnosis for anxiety, but on the post-concussion symptoms checklist, the generalized anxiety disorders questionnaires, common questionnaires that we give our patients after they've been injured, 40% of those under the age of 19 will indicate that they are struggling with increased anxiety compared to what they had prior to getting hurt. So if we think about anxiety, anxiety is one of those things, it's a buzzword. It's thrown around a lot in different aspects of life. Everything from being nervous for a test to I can't leave my house because I'm worried about the impending doom that's going to happen. Anxiety is a big, broad spectrum, just like most mental health disorders. They can mean different to everybody. But when we talk about 40% of those diagnosed with a concussion under the age of 19 will exhibit some form of subclinical anxiety, is a staggering number as well. Okay, so especially when we look at what happens after the injury has occurred, right? It's okay, the injuries happen, the anxiety goes up. Now we trigger in the anxiety of, am I going to get better? I'm missing times. What happens to school? What happens to my job or my friendships or my relationships? Now, after we've recovered, we still have those subclinical anxiety symptoms prevalent throughout the rest of our life, hoping that as we grow up and hit certain levels of puberty and brain chemistry, that it will regulate itself back out without needing external factors or treatment or medications. But it's one of those things that is something that affects patients long after the concussions actually recover. I do a lot with educating schools. I go around and present on professional development for teachers, for administration, for counselors on the idea behind concussions and academics. And as I was preparing my presentation, I came across this statistic that adolescents who sustain a concussion are 15% less likely to pursue higher education. 15% less likely to continue for school after high school. That's not just going to college or a university or, a city college. That's going into the trades, going into doing any kind of higher education beyond high school. If you get an athlete that's got, a concussion diagnosed, they've diagnosed 1 or 2 concussions throughout their high school career, and now all of a sudden it's completely changed the trajectory of their lives because they're struggling with depression, with anxiety, with mental fogginess and cloudiness, struggling with the ability to think and process and keep things straight. Now we found out that there's a 15% less of a chance that they will pursue higher education following a concussion. That's not just in our athletes either. If you have somebody who's been diagnosed with a concussion that, is in marching band or is in chess club or just fell on the ice out in the parking lot, that 15% chance less likely of pursuing higher education, I would like to see a study done on the likelihood of graduation, whether that happened in college or in high school. What happens is, they pursued that higher education, but did they finish it? I would love to see what those statistics look like, because I'm going to bet if you dig deeper into those statistics that there's going to be a change in graduation rate as well following a concussion. So if you're a concussion researcher and you want a partner, let me know. I'd be happy to help you out. So now let's flip to the adult side of things. The primary age for my clinic is adults over the age of 18, right? It's one of those areas that is very underserved in the big picture when it comes to concussion management, concussion education, concussion diagnosis. So when we look at mental health challenges for those adult patients, this number's gone up, right? If we look at teens, and patients under the age of 19 years old have a 40% chance increased risk of developing a mental health disability or a new mental health diagnosis. In adults, it's 46%. It's a 46% chance that you will have it's 46% increased chance that you'll have a mental health disability or diagnosis associated with each concussion you get. Again, not just because you had one, it's up 46%. Each one that you get increases the risk by 46%. With our patients, with our children, right? Our youth patients, our adolescents, whatever you want to call them, patients under the age of 19, it was a higher risk. 30% of our patients were symptomatic at 1 month. Post-concussion symptom, persistent post-concussion symptoms, there's varying levels of where that diagnosis actually comes into play. So when we look at it for this, 50% of our adult patients are still symptomatic at the 6-month mark. That's multiple reasons they're still symptomatic at that 6-month mark. Some of it is because they haven't done any treatment, right? They haven't done any rehab. It took a while to get diagnosed. They went through the emergency department, diagnosed with whiplash, treated for whiplash, and then all of a sudden the mental health side starts to play. We start to see decreased in cognitive abilities, balance issues, increase in headaches. Then it took a while to get the concussion diagnosis, so we haven't addressed the symptoms yet. But 50% of our adults are symptomatic at 6 months. One of my key phrases for my adult patients is the idea that life doesn't stop. When you get a concussion, life doesn't stop. Your employer expects you to still be an employee. You still have bills to pay. You still have rent due. If you're a parent, you still have to be a parent. If you're a mom, you can't just take 2 weeks off from being a mom and hope that your concussion symptoms will go away. Life doesn't stop following a concussion, which is why a lot of our adult patients are still symptomatic at 50, at the 6-month mark. When we look at that 50% still being symptomatic, a lot of people will sit for a while and try to rest, but at time, I got to push, I got to keep going. I can't just sit here. I can't lose my job. I can't lose my relationship. I can't do this. So when we look at it, that 50% still being symptomatic at 6 months is going to lead to its own mental health challenges. Again, for my adult patients, this time around, you got a 2.2 times increased risk of suicide attempts inside the first year post-concussion. And a lot of that has to do with the stress of being adult. I spent a lot of time talking about how hard it is to be a kid in today's world. It's challenging to be an adult, right? Bills don't stop. Life doesn't stop. We have to stay employed. We have to put food on the table. If we're a parent, we have to continue to provide for our family. As males, I can tell you, because, perks of being a male and a father in my 30s, I struggle with the idea of having to provide for my family and letting people down if I'm not providing or succeeding the way that I have fostered myself, or that idea behind what I have done and what I need to do as a man to provide for my family. Even though that's not realistic at all, that challenge of having a concussion or struggling through concussion recovery while you're diagnosed with a concussion, or while you're diagnosed with any kind of pre-existing mental health challenge or any new mental health issues, leads to a 2.2 times increased risk for suicide attempts inside that first year. That doesn't, it doesn't take into consideration what it does long-term and long-term health, but what it does inside that first year. And another one that I found alarming with patients is there's a 4 times chance, increased risk, or more likelihood of experiencing bouts of self-harm following a concussion. That's throughout concussion recovery and after completely recovering from your concussion. You're 4 times more likely to struggle with self-harm attempts, ideation, due to changes in inhibition in the hormone balance that happens inside the brain after a concussion. Again, we talked about it with youth athletes and the youth patients. We're going to talk about it here with my adult patients. These numbers are a little bit different, a little bit lower, because if we look at the grand scheme of life and how we're diagnosed with mental health challenges, a lot of the time going into concussions, we have a majority of patients that have been diagnosed with some form of anxiety or depression moving into it. Whether it's been a formal diagnosis or not, they put it on their medical record because they've self-diagnosed, or they've been told that they have bouts of depression or anxiety. But for our adult patients, you're up to 27% chance of an increased risk for developing clinical depression following a concussion. When we talk about depression, again, most people think depression is being sad. Depression is generally not being sad, but it's lack of emotion. I don't feel happy. I don't feel sad. I don't feel angry. I don't have the energy or the effort to get up to do things. I struggle overall mentally, physically, to get up and be myself and be a person. So looking at after a concussion having an up to a 27% chance of an increased risk for clinical depression, that doesn't take into consideration those people that will report that they've struggled with increased bouts of depression, whether it's consistent or inconsistent through their concussion recovery. If we look at the basic definition of what concussion is versus what depression is, concussions are a brain that's going slower than it wants to go with a hormone imbalance. Depression is a brain going slower than it wants to go with a hormone imbalance. They are the exact same. There is no difference in the basic definitions. In a lot of the world, you can't get diagnosed with a concussion. You get diagnosed with acute depression secondary to head trauma. So it's something that we have to navigate when we talk about, depression outside of the United States with concussions, with those research studies. We have to look at, is it being called depression? Is it being called a concussion? So those numbers, just like anything else, data is not perfect. Those numbers paint a staggering picture that you're up to a 27% higher chance for clinical depression and a 24% chance increased risk of clinical anxiety following a concussion, right? So you're over 25%, right? There's a greater than a quarter chance that you are going to develop anxiety and concussion and depression even after the concussion is healed. And then the big one here is you're up to 21% chance of an increased risk for developing post-traumatic stress disorder. This was across all across all age groups with all different types of mechanism of injury. I can tell you based on some of the research that I've done, I don't have the specific number, but after car accidents and after intimate partner violence or being physically attacked, the number of the percent of patients diagnosed with PTSD is higher than 21%. It's a lot higher. We talk about it from the very beginning with every patient that I see that's been involved in a car accident that we need to work with. We need to get in with somebody on the mental health side to work potentially with PTSD because it's common to develop issues with post-traumatic stress disorder following a concussion. One of the primary components of domestic violence and intimate partner violence support systems and support organizations and groups is working with somebody on the mental health side, whether it's a counselor, a psychiatrist, a psychologist, to help with the PTSD associated with somebody who's been physically attacked by somebody they're close to. Okay, so it's a high risk for adult patients specifically because we are more in tune or more prevalent to those intimate partner violence and car accidents compared to the adolescent athlete. A primary reason that we run into issues with concussions and mental health challenges is the way we've been told to treat concussions. One of the easiest ways to tell that you've been to a concussion provider or taken information or treatment suggestions from somebody who doesn't have the overall experience you do, or doesn't have the mental health or the education in concussion, is the idea that they tell you to sit in a dark room and wait. They tell you that, hey, go sit in a dark room. After a couple of weeks, you'll be better. You'll be fine. You take your phone, your electronics, your TV, don't go to school, don't go to work, don't go to games, don't go to practices, don't be a parent, don't be a spouse, just go sit in a dark room and hope you feel better. You tell somebody to do that, they're going to spend a lot of time thinking about how good they don't feel. So the isolation after concussion leads to increased symptoms, right? So it leads to the increase in physical symptoms, increased headaches, increased nausea, increased dizziness and mental fogginess, but it also increases those mental health challenges that we deal with, the depression, the anxiety, the PTSD, the isolation that occurs. So one of the goals to concussion recovery is we're trying to stay in as much of a normal routine as we can. The challenge is we have to navigate increasing symptoms. So in one of the biggest challenges that we have on the rehab side of things is navigating the fine line between doing too much and not enough. Now you add into the mental health and the depression, anxiety challenges that come along with that. It's very challenging to navigate through concussion recovery without increasing symptoms overall. So how do we treat mental health disorders, mental health diagnoses, mental health challenges, however you want to refer to mental health? How do we treat mental health during a concussion and following concussion recovery? There are a bunch of different ways, but there are two things that I like to cover with every single one of my patients that comes through the door. I call this the big picture, the overview, the things that are going to help. I am trained to help with the mental health side of concussion very specifically, but I will not pretend to tell you that I am trained to deal with mental health in general. There are two primary groups that I will recommend. The first one is any cognitive behavioral therapist, especially one that is specifically trained in traumatic brain injuries and brain injury navigation. Concussions are very, very different when it comes to mental health than just your quote-unquote standard mental health diagnosis. The chemical imbalance, the frequent changes in symptoms, the frequent isolation that occurs after a concussion, the PTSD, the trauma that's associated with a concussion makes it so we're taking a mental health diagnosis or disability or mental health challenge that's unpredictable already, and then throwing in the unpredictability of a brain injury. When I try to discuss depression or anxiety after a concussion, I talk about it being a grease fire. It's not really hot, it doesn't burn really big flames, but it's always there. It's always a challenge, and it's always something that we're trying to navigate. Now, a concussion is like taking a football and spiking it right in the middle of that grease fire. We take that grease fire, we throw the grease everywhere. Now all of a sudden the grease starts to settle back down, right? So those depression and anxiety symptoms will start to settle back down. But now all of a sudden the curtains are on fire, my drapes, my carpet's on fire, the living room's burning down, and I got to put out these individual fires before I can come back and address the underlying cause of the mental health challenges, which is the brain injury itself. So the two things, or the two specialists that I talk about and will send a lot of patients to, is a clinical social worker, somebody on the counseling side, a psychologist, a psychiatrist, somebody who's specifically trained in traumatic brain injury and post-traumatic navigation for depression and anxiety, and then a neuropsychologist. Neuropsychology is a godsend when it comes to concussions. I want every single one of my patients to have a neuropsychology evaluation on the very first day that I work with them. The challenge is we don't have very many neuropsychologists in the area that treat adults, number one, and number two, that specialize in brain injuries. Then you add on the fact that neuropsychology evaluations are very time consuming and very labor intensive and cost intensive. Most insurance companies right away will deny a neuropsychology evaluation if there's an acute injury that's occurred. They want to play the sit and wait game. So they'll deny a neuropsychology evaluation. So if you can get in, there's a chance that an insurance company won't cover it, and they're expensive. But in the big picture, a neuropsychology evaluation will be able to identify what mental health challenges that you're dealing with that were present prior to the injury, what's associated with post-traumatic stress disorder, what's the actual concussion itself, and can help provide treatment and navigation of treatment through your concussion recovery. So if you're somebody, especially an adult, that's dealing with mental health challenges or any increase in mental health diagnoses or disorders outside of your normal, and we run into, the cognitive behavioral therapy side and the neuropsychology side, I will 100% always, stand on the soapbox, pound the drum, always recommend that you get in to work with somebody who's formally trained in diagnosing and treating and navigating traumatic brain injuries and mental health disorders. Let's say you're not ready for that. Society's put on that you're not allowed to go talk to somebody. Finances are cheap. Finances are tight because we're out of work. You're navigating through brain injury recovery. What are some of the things that you can do on a daily basis to help improve mental health? The first one that I go through, these are my top three that I talk with all of my patients about. The first one that we've got to work with patients on, and it's one that takes a little bit of time to get patients to trust us with, is the idea behind avoiding isolation. They were told by the emergency room, their primary care, somebody who's not trained in concussion management or not updated with their concussion management, that they need to just sit in a dark room and wait until they feel better. That isolation is a problem. We need to make sure that we're doing that fine line between doing too much and not enough. We need to stay in as much of our normal routine, which is number two, stay in as much of our normal routine as we can during concussion recovery without overloading our system. If TVs and computers are hard for you, we don't just avoid TVs and computers. We make modifications and accommodations so we can use them more effectively and more efficiently. I have a lot of patients that struggle with screen time. I run a 100% virtual concussion clinic. Kind of an oxymoron if we aren't trying to navigate the world of making those modifications, layering in stimulus and slowly bringing that stimulus back to you to help you navigate through. That isolation, sitting in a dark room, not going out, not seeing people, not going to dinner, not seeing friends or family, avoiding, big gatherings, not going to church, that will significantly decrease the mental health of anybody, let alone somebody who's dealing with the chemical imbalance or the hormone imbalance that occurred post-concussion. So we have to get you to avoid isolating in a dark room, and we have to establish a routine. Establishing a routine is challenging for anybody that we alter their daily schedule. Let's say we take you off work because of the injury, or we take you out of school because of the injury. Now we have to fill 6 to 8 hours of your day with something else. If I don't have to get up, why would I wake up? Right? If I can sleep all day, why not sleep all day? Well, the challenge is if you sleep all day, you're not going to sleep at night. And we need to prioritize sleep. Right? So the three things that we're looking at, we want to avoid isolation, trying to keep our normal routines as best we can, and then prioritize nighttime sleep. Sleep is where we regulate our chemical hormones. It's where the brain goes through and restores its major chemicals. It's where it produces human growth hormone to fix the injury and reconnect neural connections post-concussion. It's also where we help navigate and kind of regulate the hormone imbalance that occurs after a concussion. So if we're looking at the three basics that you can do on a daily routine or a day-to-day basis, we want to avoid isolating, establish a routine and maintain that routine, weekdays, weekends, out of work, out of school, in school. We want to establish a routine and stay consistent with it. And then we want to prioritize nighttime sleep. Some of the other things that we can do that are a little bit less, I wouldn't say less important, but if we're looking at these three are the main things that we should do: avoiding isolation, establishing a routine, and prioritizing sleep. This is section 1A. This is 1B. We want to prioritize movement. Exercise is medicine. So when we're looking at concussion recovery, we want to make sure that we're doing subsymptomatic aerobic exercise every single day. When we're trying to navigate non-brain injury related mental health challenges, right? Clinical depression, clinical anxiety, PTSD, something that wasn't attributed to a concussion. Exercise is medicine. The idea of prioritizing at least 30 minutes of aerobic exercise every day can help reduce stress and improve mental health overall across all age groups. When we talk about aerobic exercise, I'm not telling you to go out and try to run a marathon. I'm not telling you to go out and run sprints. Get out and go for a walk. Walk around the yard. Get out and take the dog for a walk. Go out and push your kids on a bike. Get outside in the sunshine, in the grass, do some grounding, get out and prioritize some aerobic exercise. The second thing that I talk about on tier 1B is our mindfulness. Establishing positivity. It's really easy for me to tell you, hey man, you need to be positive, especially when you're dealing with a brain injury, especially when you're dealing with any mental health diagnosis, especially when you're dealing with a brain injury and any mental health diagnosis. It can be really, really, really hard to stay positive, to look at the bright side of things, to stay upbeat, and to stay energetic. It is very challenging, and I am not one to sit here and tell you that, that's not true or that doesn't make sense. Okay, when we look at brain injuries as a whole, establishing positivity is something that helps the brain heal faster. With my patients, I promise them two things: expertise and access when they use my clinic. The access side is not just that I'm available for easy scheduling. It's that I am an advocate to help you with your mental health. If you have things that are bothering you in real time, I want you to reach out. If you're struggling with increased anxiety and you can't get the anxiety spiral to stop, I want you to reach out. I will be the over-the-top optimistic and positive person in your concussion recovery. Because if I can stay consistent in my messaging, the likelihood that you'll start to believe me goes up. Okay, concussion recovery can feel like Groundhog's Day. Mental health challenges and mental health disabilities can feel like Groundhog's Day. I go to bed and I wake up the same way every single day. Every day is the same routine over and over and over and over and over again. That we run into those issues with seeing how far we've come in our recovery, seeing how far we still have to go. We get stuck in the mud. Having a support system that can stay positive while also staying realistic can be very beneficial when navigating mental health challenges post-concussion and outside of the concussion world. The third thing in tier 1B that I like to talk about or discuss is the idea behind being creative. We have two different sides of the brain. We've got a right side, we've got a left side. We've got a black and white analytical side, and we've got a creative side. Expressing creativity, colorful, different colors, music, drawing, coloring, sculpting, putting Legos together. Expressing creativity and being creative is a way of helping reduce stress and improving mood, even outside of the post-concussion world. If I've got somebody who we've been treating for a while or who's been navigating through post-concussion syndrome for months or even years after their injury, one of the first things that I will try to get them to do is find an activity that they enjoy that's creative, and we want to prioritize their happy place and make that creative activity their happy place. It helps us regulate mood and improve mood and help regulate chemical imbalance following a concussion. So again, tier 1A, we want to avoid isolation. We want to establish a routine, can stay consistent in our routines, and we're trying to prioritize nightly sleep. 1B, we're trying to prioritize movement. Exercise is medicine. We want to work on establishing mindfulness and being creative. But when we talk about trying to establish positivity and trying to maintain a positive outlook, how can we do that? we have to maintain and control our stress. So these are 4 techniques that I like to talk about with every single one of my patients on how we maintain stress and how we reduce stress during concussion recovery and even outside of concussion recovery. If I have somebody that's really struggling, I like to use the 3 positive events rule. Some people like to call it something different. I refer to it as 3 positive events. At the end of every day and the beginning of every day, I want you to physically write down on a piece of paper, on a notepad, putting it in a notes section of your phone. I want you to write down 3 positive things. If it's the end of the day, 3 things that you really enjoyed about your day, 3 positive memories that you have from the day. If it's the beginning of the day, I want you to write down 3 things that you're looking forward to moving forward through your day. They can be as in-depth as you want them to be, or they can be as basic as you want them to be. Some examples that I give patients, it's like, today was great. I had a good day. My symptoms were low. I had lobster tails for dinner, and I've been looking forward to eating lobster tails. Or I was able to navigate through church and see my best friend that I haven't seen in 6 months because I was able to get back to church or get back to going out to a family gathering, or I got to go out and see somebody that I haven't been able to for coffee. Like, those are your positive events that keep you going in the big picture, because it can be hard to find positive things throughout your concussion recovery. So the 3 positive events is a thing that I do in my day-to-day life. I like to go through and write down 3 things that I enjoyed about each day and 3 things I'm looking forward to as I go through and try to improve my own mental health, that I will push with patients to try to get them to navigate during concussion recovery. The second daily routine that I would recommend is a 30-minute walk. Okay, get out and go for a walk. Walk around the neighborhood, or walk around the yard, getting out and just, pacing back and forth. When I'm doing any kind of brainstorming or any thinking and thought processing for the business, for personal, I will take a tennis ball, toss it around, and I'm walking back and forth. I pace. A joke that I give with patients is it's like I wear out the floorboards in my office. I'm just pacing back and forth because it's how I keep my thoughts straight, and it's how I work on my thought processing, brainstorming. When we look at it, exercise is medicine. It's a way to reduce stress, getting out in the sunshine, going outside, getting out in the sunshine, feeling the fresh air on your face. It allows us to practice grounding techniques, which the brain is conditioned to love at the very beginning anyway. Sunlight helps regulate some of our sleep hormones, and getting outside and prioritizing increasing our heart rate during aerobic exercise can be a great way to help reduce and control stress. Daily meditation is something that I will talk about when I can be perfectly honest with you. A lot of my male patients look at me and go, I'm not doing that. Meditation looks different for everybody. It's not just sitting in cross-legged stance with monks and Venetian singing bowls and talking about centering your chakra like we see with yoga or Tai Chi. Daily meditation can be anything from reading a Bible, reading a book, listening to guided meditations, listening to a podcast, bird watching, something where it's something we enjoy doing. It's our happy place. Sitting down, trying to sit down and focus on being present in the moment. Thinking about how you feel sitting in that moment, sitting in that environment, is a way to practice meditation without actually calling it meditation. I'm very good at reading people. If I have somebody who I know will not buy into the meditation side, I will call it something different. I will call it our daily happy place or our daily routine. With my athletes, when I'm trying to talk about meditation, I'll talk about it being their daily vitamins. Vitamins are something you're supposed to take every day. When it comes to working in the professional basketball world, it's drills that every single athlete was supposed to do every single day to make sure that they're getting in the basics, working on the fundamentals. So I'll talk about it and phrase it differently with each individual patient based on their receptiveness to what I talk about in terms of taking care of your mental health. The last thing that you can do that's very easy, it's a little bit more in-depth, but it's the same concept as the 3 positive events, is daily journaling. Spending time journaling every night. When we talk about journaling, generally it's somebody who's struggling with the 3 positive events rule that I like to give out. It's somebody who's struggling to find positive things every single day or things that they're looking forward to every day. So we'll talk about keeping a journal of just kind of going through and regurgitating what happened throughout the day. The good, the bad, the ugly, putting it down on paper. And then physically destroying it, tearing it up, crumbling it up and throwing away, tearing it into a bunch of little pieces, deleting it from your phone. With my adults, if you want to safely light it on fire, go for it. But it's a way of de-stressing by taking things that challenge you throughout the day, putting it down on paper, and then the physical act of destroying it can help with the psychology of letting things go. So some things that you can do that I like to talk about that are effective for a lot of my patients. My 3 positive events, the beginning and end of each day, going out and going for walks, doing some form of daily meditation, adding yoga to it or Pilates to it is great. Yoga is the best form of aerobic exercise out there. In my opinion, people would be better people, nicer, more relaxed if they could prioritize yoga in their daily routines every day. And then some form of journaling if you're struggling overall. So, easy techniques that you can try that are outside of the world of sitting down and prioritizing time, taking my time out of my daily routine or my daily schedule to do these hard things that you talked about. These are easy things that you can do, especially if you're struggling with increase in mental health challenges, increase in concussion symptoms during your day-to-day life, right? Whether you're at school, you're at work, you're sitting at home and you're struggling. The 2 techniques that I talk about with a lot of my patients are any kind of breathing technique. Here I listed the 4-7-8 technique, and I'm going to demonstrate it with you right here. With patients that are struggling in the acute concussion world, we'll talk about nasal breathing, just taking big deep breaths in through your nose and then slowly exhaling through your mouth, because putting a time on it can really challenge breathing patterns. It can lead to increased lightheadedness during concussion recovery. From a generalized anxiety and depression side, the 4-7-8 breathing has a lot of research that's been done behind it to help regulate temperature, regulate heart rate, mood disorders. So when we talk about breathing techniques, I always want everybody to sit in a quiet environment, feet flat on the floor, arms crossed across their chest. When the breathing techniques to help gauge belly breathing versus chest breathing, I like to have them put their dominant hand or their right hand on their chest and their left hand on their stomach. They're relaxing their shoulders. They're tucking their chin down to your chest. You're breathing in through your nose, pushing your belly button out into your hand. So the idea is you're breathing in through your nose, taking that big deep breath in, pushing your belly button out to your spine, and then holding your breath for a count of 7 seconds, and then slowly exhaling through pursed lips like you're trying to whistle for a count of 8 seconds. So if I'm doing this with a patient, sitting here and demonstrate, it's breathe in for 4, hold for 7 seconds, and then slowly exhale for 8 seconds. If you're not dealing with concussion symptoms, that's a great way to help settle yourself and your system down and help regulate mood. If you're struggling with the concussion and mental health, we may need to change those numbers. Those numbers and timing can be arbitrary. The first thing that I will do is I will take the hold the breath side of things out. I will make it just slow inhale and slow exhale. But the 4-7-8 breathing, box breathing, belly breathing, those are all ways to kind of regulate our central nervous system, and trigger our brain to trigger out of the fight or flight response into the parasympathetic repair and regenerate, and help improve mental health overall. The second one here that I've got on the screen is rhythmic tapping. The idea falls into the same routine that we're trying to focus on slowing our respiration rate. But when we have somebody who's struggling to relax, especially if we're in an acute anxiety attack or a panic attack, it's really hard to tell them to focus on breathing without giving them something tactile to do. So basic challenges, basic things I like to do with my rhythmic tapping. Again, sitting with my feet flat on the floor, relaxing my shoulders. I can put my hands flat on my desk, on my thighs. I can cross them across my chest. But I always like to assign a pattern based on dominant hand and non-dominant hand. So as a right-handed person, if I'm going through a set of rhythmic tapping, I'm crossing my arms across my chest. I'm taking a big deep breath in. And as I breathe in through my nose, I'm pushing my belly button out, trying to take it out as far away from my spine as I can. And I am slowly tapping my dominant hand. And then as I exhale, I'm exhaling through pursed lips, pulling my belly button to my spine, and I am tapping my non-dominant hand. The idea is you're trying to get a patient to focus on the tapping. Tapping while breathing in, tapping while breathing out. It gets them away from the idea that they're short of breath, that they're struggling with hyperventilation that can come with an acute panic attack or an acute anxiety attack, and gets them to focus on the tangible side of focusing on our tapping. It can be very simple patterns. If I have somebody that's struggling with that feeling of short of breath or feeling overwhelmed, I will change my patterns frequently throughout working with them. dominant hand led, non-dominant hand led, upper extremity, lower extremity, crossing the body versus staying out. The idea behind rhythmic tapping is we're trying to get the brain to regulate the autonomic system, regulate heart rate, blood pressure, reduce our stress hormones and cortisol, and improve our overall respiration rate by slowing everything down. 2 easy techniques, try them out. If you got a technique that works for you, I'd love to hear about it. Shoot me a DM, shoot me a text or an email. Say, hey, Matt, this is what I like to do to help navigate my anxiety, because I know there are a bunch of different tips and tricks to help with anxiety. These are 2 that I have found work great with people in an acute distress situation, and that it's something that patients will do in the big picture. Again, so every 3rd Wednesday of the month at 12 p.m. Eastern Time, we use the MCC monthly lunch and learn, about an hour where I sit down and talk about something that has to do with concussions. I encourage everybody from patients to their support system, healthcare providers, mental health providers, the curious people that stumble across me on social media. I always encourage you, bring your lunch, let's talk about it, let's figure it out. Today we talked specifically about mental health and concussions and the silent struggle that occurs with most of our patients after a concussion. We talked about concussion information and statistics, concussion prevalence, that link between mental health and concussions, what it looks like for adolescents and what it looks like for our adults, and then some basic tips and tricks on how we can treat them, how we can go through it. If you missed out on the beginning of it, it's always going to be up on YouTube. We're live on YouTube now, as well as our TikTok. It's going to be up here. I plan on breaking it down into smaller, digestible sections, but the idea is it's going to be up there. It's going to be out there forever. I use it as a way of kind of reassuring my patients that if I'm talking about it in a one-on-one setting and it lives on the world and the internet for everybody to see, it must be something that I believe in. So again, my name is Matt Campbell. I am the owner of the virtual Midwest Concussion Clinic. We offer 100% virtual concussion treatment, education, awareness, advocacy, all at the comfort of your own home. If you're working with a sports organization or you've got somebody who needs concussion education, I do a lot of presenting. I do a lot of speeches. I come out and talk a lot about concussions. I hop on my soapbox and educate as many people that'll listen on concussions. If you want to learn more, you're trying to follow along the journey, we're at MW Concussion on X, Twitter, whatever you want to call it, TikTok, Instagram. We're at MW Concussion on Facebook, and we've got our YouTube channel at MW Concussion over on YouTube. I'm very accessible. I answer questions. My goal is that if I'm helping people in life, I'm doing what I should be doing as a human being, not just in my business. So if you have questions, shoot me an email, shoot me a text message at the numbers on the screen at MW Concussion. DMs are always open. Feel free to reach out. As always, if you follow along, if you watch, thank you so much for allowing me to do what I do on a regular basis. Thanks for following along, and tune in next time, and we'll see you at the next go around. Take care.